Hello everyone, I'm Dr. Alia from Kodepot Hospital.
And I'm Dr. Denson from Tan Tock Seng Hospital. We are bariatric surgeons and we specialize in performing surgeries or procedures for weight loss. There are surgical and non-surgical procedures to help with weight loss. Bariatric surgery is the most effective and durable way for patients to lose weight and improve their metabolic disorders. For patients who are unwilling or unable to go through surgery, we have alternatives such as intragastric balloon and endoscopic sleeve gastroplasty. More on those in another video. We will cover the surgical procedures in this video and the non-surgical procedures in the next video. Bariatric surgery is weight loss surgery for patients who have morbid obesity and/or obesity-related conditions such as diabetes, hypertension, and hyperlipidemia. In NHG, the two most common bariatric surgeries that we perform are sleeve gastrectomies and the Roux-en-Y gastric bypass. We can perform bariatric surgery for patients who are morbidly obese with a BMI of more than 37.5 or more than 32.5 if they are obesity-related conditions. We perform all bariatric surgeries using minimally invasive techniques through 4 to 6 small incisions, regardless of whether it is a sleeve gastrectomy or Roux-en-Y gastric bypass.
As the name suggests, we remove a sleeve of the stomach, reducing the size of the stomach by about 70 to 80%. The resected stomach will then be removed from the patient's body. There is no alteration of the small intestine, hence digestion and absorption of food is the same as before. The main advantage is that it does not need to create a new connection between the stomach and the small intestine, what we surgeons call an anastomosis. Hence, there is almost no risk of marginal ulcers or internal hernia, which may be associated with the Roux-en-Y gastric bypass. The chance of nutritional deficiency is also less likely with this method. If you have severe gastroesophageal reflux, a sleeve gastrectomy may not be suitable as it may worsen the reflux.
It creates a small gastric pouch that food can be delivered to. It is separated from the remaining stomach using surgical staplers. This new smaller stomach will then be connected to the small intestine further down, bypassing the larger remaining stomach and the early segment of the small intestine. The gastric and digestive juices from the remaining stomach, pancreas, and earlier portion of the small intestine will still travel down the bypass segment and meet food from the new, smaller gastric pouch. This means that food will then be digested in the later segments of the small intestine. The surgery has two purposes. Firstly, because the new gastric pouch is smaller, it restricts the amount of food consumed by the patient. Secondly, digestion and absorption occurs much further down the small intestine, hence fewer nutrients and calories are absorbed, which results in malabsorption. The RYGB might be a better surgery for you if you have severe reflux or diabetes. RYGB has been shown to be more effective in improving and even curing diabetes compared to the sleeve gastrectomy.
For both surgical procedures, most patients are required to stay in the hospital for about 1 to 2 days after surgery. Almost all patients only require oral painkillers for their small incisions, and most are able to walk a few hours after surgery. Patients are able to consume a liquid diet the morning after their surgery.
The bariatric surgery department in NHG ensures multidisciplinary care. This means that a team consisting of an endocrinologist, a bariatric physician, dietitians, physiotherapists, and psychologists will be assigned to you. Together, we will help ensure that your weight loss journey and medical conditions are on the right track by following up with you closely before and after all procedures.